Carry on with our discussion on Ebola now with Daniel Berman, the General Director of Médecins Sans Frontières, in other words, or better known in English as Doctors Without Borders. He's the General Director here for Southern Africa. Good to have you on the program, Daniel. I guess you must be a little concerned about colleagues of yours. You have doctors all over the continent who are no doubt exposed to the Ebola virus. Are you taking any particular precautions?
Maybe before I tell you about the precautions, I can tell you about what we're actually doing. We have about 700 staff in the 3 countries, and we have every possible aspect of the outbreak response we're working on. So we have isolation centers. We have an isolation center in Sierra Leone that has 90 beds. Perhaps it's the biggest Ebola hospital that has ever existed. And I think in terms of this massive effort that we're doing, even with all of this work, we are very, very glad that WHO has declared an international health emergency. Why? Because it means that that the response can be scaled up. Because it's just a first step to declare an emergency. But what we need in terms of implementation is we need massive deployment of experts and supplies. So I'm talking about things like infectious disease doctors, epidemiologists, people that can run labs. It's not going to be enough just to give money and to train people, but we actually need countries that have this capacity to release those people and send them to this region to mount the response.
Daniel, we spoke earlier with Sarah Barber from the World Health Organization. She said there were 1,711 confirmed cases of Ebola, of whom 932 people have died, 55% death rate. Have any of your doctors, any of your staff on the continent contracted the virus?
I'm glad to say, because of protocols that we have developed over many years, none of our staff have contracted Ebola. And the reason for that is we take extraordinary precautions. So people have seen the suits that our staff wear, with the boots, with the full covering, masks, and not only do they wear that protective gear, but it's about how they work. So, for example, they work in the buddy system. No one is ever alone in an isolation unit, meaning there's always 2 people working together, so that if somebody starts to get tired, or if they're not at the top of their game, then their buddy can suggest that they leave and that they leave the hospital. And I think by taking this very, very seriously, we know that we can prevent infection, and that goes for the communities as well. What's happened is people are afraid because there are deaths in their communities, and so they're not going to treatment centers. I think one of the things that needs to happen is people need to know they have a better chance to survive if they do get into an isolation unit. Another big thing we've been facing is the burial rights in Western African countries. People normally, out of respect and to give the person who has died dignity, they clean the body. But in an Ebola outbreak, this cannot happen, because when people are very, very sick, at the end stage of the disease, that's when they're the most contagious.
Daniel, when we have a look at the visuals of your staff, and as you say, with the uniforms and the precautions that are being taken, in a perverse way, that also concerns, or is of concern to the public, because if you're going to such extraordinary lengths, then if somebody who has Ebola were to come into closer contact, there's just a perception that it'll be easier for the disease to be transmitted. Can you tell us categorically how the disease is transmitted, or how a member of the public can ensure, by just being careful, that they will not contract it?
You know, you make a very good point, and we've actually discussed that amongst ourselves, that the protective gear looks scary and may scare people. But I think the most important thing to say is this is not an airborne disease. So unlike the flu or other diseases, you can't get this from someone sneezing. You can't get this from being just in the same room. How you get this disease is direct contact, so touching either a person or touching bodily fluids. And when people get very sick, they vomit, they lose control of their bowels. That's why we use the protective gear. It's when people are very, very ill, they become very contagious. But I think I can say categorically that even in most African countries, people are not at risk, because unless you've come in contact with someone who is already very sick, you can't get this disease. So I think that's important to say. And what's happened in these communities is there's been a sort of tipping point. In other words, there are so many people in the community that the health services didn't respond quickly enough and effectively enough. So back to what WHO is saying today, it's not about an international emergency, meaning that there are many, many countries impacted. They call it international because we need an international response. In this particular case, we at Doctors Without Borders have to be humble. We can do a lot, but we can't manage this. We can't run the response. WHO has to do this. And we are overwhelmed, even though we have a lot of capacity. Right now, the situation, especially in Liberia and Sierra Leone, calls for many more organizations and experts. And not from necessarily humanitarian organizations, but it needs to be a government response.
Daniel, very quickly, the East African outbreak or alleged East African outbreak, is that accurate? Have you had any information on it?
I'm sorry, can you repeat the question?
The East African or the outbreak in East Africa, is that accurate, or is it at this point in time still unconfirmed?
I have not heard anything about that, no.
Let's hope that it is and remains unconfirmed. Daniel Berman, one of the good guys, General Director of MSF Southern Africa, Doctors Without Borders.